Okay, we still have people dribbling in, but we're going to get started anyway because we have some really important information from one of my heroes in the health field. And I'm talking about a gentleman who wrote the foreword to Forks Over Knives, who's on the Board of Governors of Case Western University, who was involved with the China study, has talked a lot about the relationship between diet and health and well-being, particularly cardiovascular well-being. He's written a book called Prevent and Reduce Heart Disease. Join me in welcoming Dr. Caldwell Esselstyn.
Maybe that'll make it better. I'm certainly indebted to the kind invitation to be with you today from the leaders of Health Freedom Movement. And if I get right to the topic, if the truth be known about coronary artery heart disease, the leading killer of women and men in Western civilization is nothing more than a toothless paper tiger that need never ever exist. And if it does exist, it need never ever progress. Why? This is a completely benign foodborne illness. Now, these always work better when you turn them on. All right. Now, let's look at really what is a tremendous conflict. And that is that coronary artery disease, which is the leading killer in Western civilization, is not even known in half the planet Earth, right? Suppose that you were a heart surgeon and you decided you were going to hang out your shingle. Okinawa, rural China, the Papua Highlands in New Guinea, Central Africa, the Tarahumara in northern Mexico. Forget it. You better plan on selling pencils. Why? They don't have any cardiovascular disease there. Why? Because they are all whole food, plant-based nutrition without oil. No heart disease. Okay. Now this is the oldest slide in my presentation. 1968, I was leaving Vietnam. I had spent a year there as a combat surgeon. My training at the Cleveland Clinic and my duties at the Cleveland Clinic were as a general surgeon. But halfway through my career, I got rather fascinated about nutrition. All right. Now, the reason I have this slide is to remind the audience that, folks, if you want to sit, there's plenty of seats over here, is to remind the audience that if we autopsy our GIs who died in Korea, 80% of those average 20-year-olds will already have gross evidence of coronary artery disease. Not enough for their cardiac events yet, but there the disease is already starting. So that study was then repeated 45 years later, this time looking at young women and men between the ages of 17 and 34 who have died of accidents, homicides, and suicides. Now, the disease is ubiquitous. You graduate from high school in this country, you get a diploma, and you also get the foundation for heart disease. Not enough for your cardiac events, but there it is. Anybody in this audience over 17? I always do a better job when I'm working with patients. All right. Now, here we had a chance to get it right. In World War II, when the Axis powers of Germany overran the Low Countries of Holland and Belgium, it was characteristic that they took away their livestock for their troops. So their cattle, their sheep, their goats, their pigs, their chickens, their turkeys, gone. Suddenly, these Western European nations, including Denmark and Norway, were plant-based. And Drs. Strom and Janssen reporting in England's leading medical journal, The Lancet. In 1951, they looked at the death rates from stroke and heart disease in Norway during this time period. So let's look at this together. Here we see 1927, deaths in Norway from going up from heart attack and stroke. 1930, going up. 35, going up. 1939, in come the Germans. 1940, whoop, 41, whoop. Who knew these Germans were these great public health educators? But look what happened in 1945 with the death of Adolf Hitler, the cessation of hostilities in the European theater. Immediately, back comes the meat, back comes the dairy, back come the strokes, back come the heart attacks. But we just didn't get it, okay? We didn't get it. Now, you were looking at a slide, and on the right is an artery that obviously is thoroughly diseased. And what you're probably saying about looking at that, right there, that tiny little opening, you're going to say, when that closes off, there'll be a heart attack. Interestingly enough, this kind of blockage only causes 10% of heart attacks. We'll talk about how the other 90% have occurred shortly. 10% of heart attacks occur that way. Why? Because so often, I mean, this has taken years and years to develop. So often what happens is the downstream heart muscle is so annoyed at the fact that it's not getting its share of oxygen and nutrients, it develops around the outside of this artery little tiny threads of blood vessels making its own bypass. These are called collaterals. And the collaterals are enough often that when this closes off, there'll still not be a heart attack because there is sufficient blood coming from these collaterals to sustain the downstream viability of that heart muscle. Yes, there'll be chest pain, shortness of breath. Now let's look at the one on the left. Even those of you in the back can see this little tiny dark line. This is the key. There are two words I want you to learn today. One is endothelial. These are the endothelial cells that line the inside of our artery, and they have a magic job to do that we'll find out about shortly. Now, when you are eating a pizza, milkshakes, cheeseburger, things in your bloodstream, your cellular elements become sticky, okay? And now, this is the one I know you've all been waiting for. Let me make some sense out of it. This is from Peter Libby from Harvard. And even though I went to Yale, it's okay. Harvard has got it right. Here we see what? Blood is flowing up here in this blue area. These purple cells are the endothelial cells, which are separating the flowing blood from the artery wall. Now let's together do this. Let's look in the upper left. Here's your bad LDL cholesterol, which is now sticky because you've been eating the pizza. And it bumps up against the sticky endothelium, finds a crack, a fissure, or an opening, migrates into the subendothelial space, whereupon it is rapidly oxidized, which is why Peter Libby now colors it yellow. So now you have an oxidized, small, hard, dense, bad LDL cholesterol in your subendothelial space, which doesn't like that. Calls upon the SWAT team to come across and gobble it up like Pac-Man, gobbling up all these small, hard, dense LDL particles until we get all the way over to here. When we in medicine do what we do so often, we change the name. It's now a foam cell. And the foam cell is truly the Darth Vader of this entire sequence of events. Why? What does a foam cell do? The foam cell manufactures these nasty enzymes we call metalloproteinases. Stromelicin, elastase, collagenase, myeloperoxidase. What do these metalloproteinases do that's so bad? What they do is they progressively erode the cap over the plaque. It gets so thin up here at the top. The sheer force of blood racing over it tears it. Now that seminal moment has occurred. You have ruptured your plaque. You have ruptured the cap over your plaque. And now there is the oozing out of, if you will, the extravasation of plaque content out into the flowing blood where it activates our platelets, our clotting factor. And in the next several minutes, now we have a clot. A clot is forming here, which is now, in and of itself, self-propagating. So that clot goes over to here. It enlarges to the point it is totally blocked, the entire artery. All the downstream heart muscle is now deprived of oxygen and nutrients and starts to die. And that's 90% of your heart attacks. Because you see over here, this is a blockage of what, 35%. You're not going to get symptoms until you get over 75% blocked. 35% blockage is probably half of Chicago. All right, so here we are with a heart attack. And if I do my job correctly this morning, every one of you, and your friends and relatives if you want, should be able to make themselves heart attack proof. How are you going to make yourself heart attack proof? You're not going to do it with a drug or a pill. You're not going to do it with a stent or a bypass operation. You're going to make yourself heart attack proof by changing your biochemistry. How are you going to change your biochemistry? By changing your food to whole food plant-based nutrition. When you do this, you stop this cascade of events I've just described. You don't have migration of your LDL cholesterol into the subendothelial space. You don't have the development of the foam cell. You don't have the metalloproteinases that are trying to thin out the cap over your plaque. As a matter of fact, you do this, you strengthen the cap over your plaque. If you strengthen the cap over your plaque, you cannot rupture. If you cannot rupture the cap over your plaque, you've made yourself heart attack proof. How long does that take? I should be able to show you 3 weeks. All right. Now, you thought I was through with the endothelial cell. Well, we're just beginning because this is an important, you can see, forget the x-ray here. Here the artist has given us an artery. Half of it is filled with plaque. And the cells that are lining the opening are the endothelial cells. And up until 1980, we used to think of the endothelial cell as just those cute little red bricks that were lining our wonderful artery pipes. That all changed in 1980 when Dr. Furchtgott, working in Brooklyn, was taking the largest blood vessel from the rodent, the aorta, and he would put the knife to it and do this sort of elliptical spiral staircase cut all through that aorta. Then he would immerse it in a bath of saline and it would constrict. One day, no cut. No cut. Took the aorta, immersed it in saline, whoop, it dilated. So now, suddenly, the race was on globally. What was the EDRF, endothelial-derived relaxation factor, that Dr. Furchtgott had discovered? Well, fortunately, that term was with us only 8 years. At the end of 8 years, Dr. Furchtgott, Lou Ignarro, and Dr. Murad discovered that the EDRF was a gas, nitric oxide. And for that, those three gentlemen in 1998 received the Nobel Prize. Well, what was so valuable about nitric oxide? Well, its functions. Nitric oxide is the absolute salvation and protector of all of our blood vessels because of its functions, which include: one, it keeps all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. Number 2, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, to your legs, they widen, they dilate, nitric oxide. Number 3, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed, protect you from getting high blood pressure or hypertension. Number 4 is the absolute key. A safe and normal amount of nitric oxide will protect you all from ever developing any blockages or plaque. All right? So literally, everybody on the planet, whether they're from London, Berlin, Chicago, New York, or Tinley Park, if they have cardiovascular disease and blockages, it is because by now in the preceding decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into a train wreck. They no longer have enough nitric oxide to protect themselves from making blockages or plaque. But the good news is this. This is not a malignancy. This is a benign foodborne illness. And once you can get patients to never again pass through their lips one single morsel that is going to further injure their endothelial cells, then the endothelial cells recover, make enough nitric oxide so you no longer have any disease progression, and we frequently will see elements of disease reversal. Pretty exciting stuff. Now, as I look at this highly intelligent group, I can see you're all sort of asking to yourselves, I wonder what my level of nitric oxide is. We don't measure that yet in the doctor's office, but in the research setting, if you take an ultrasound probe and place it over your brachial artery at the elbow, there on the screen is the readout, okay? Then for 5 minutes, you encircle the upper arm with a blood pressure cuff, inflate it above systolic blood pressure so that for 5 minutes, zero blood flow to your forearm and hand. I've had that done, not exactly habit forming. Then you take the cuff off and immediately measure the new diameter of the brachial artery, again with the ultrasound probe. And the normal individual, it'll now be 30% greater because of the outpouring of nitric oxide from your endothelial cells when that tourniquet was in place. Now, suppose that you're 8 years old. Here is the level of nitric oxide. Did you ever hear of anybody who was 8 years old having a heart attack? Nitric oxide is pretty high. But you blink your eyes, suddenly you're 24. And sadly, you get hit by a bus, you're dead, you get autopsied. What do they find in your artery? Plaque. Not enough for your artery, for your events yet. There's the plaque. Now, suddenly your hand is down here at your navel. I get a phone call. A 48-year-old gentleman. Dr. Esselstyn, you'd be proud of me. 2 weeks ago when I had my heart attack, since then, I've been following your program 80%. My answer? I have no idea whose program you're following. But that's not mine, and what you have told me is this. You have so injured your endothelium that at age 48 you had a heart attack. And now what you're telling me is that 20% of the time you are still trying to further destroy your remaining endothelial cells so you can have a second heart attack. Okay. Now, the next great thing that happened was Dr. Robert Vogel, chairman of cardiology at University of Maryland. And what Vogel did was interesting. He took a healthy group of young students to a certain fast food restaurant characterized by arches which are golden. Half of them had the cornflakes. Brachial artery tourniquet test, normal. The other half had the hash browns and sausage. Within 120 minutes, when the brachial artery tourniquet test was done, they couldn't dilate the artery. That single meal of hash browns and sausage had so destroyed, so injured their endothelial cells, they couldn't make enough nitric oxide to dilate the artery. But as they followed them into the late afternoon, early evening, they began to sort of recover. But you and I know that the next morning for breakfast, scrambled eggs and bacon. Lunchtime, white bread with mayonnaise and cold cuts. Supper time, baked potato with sour cream, lamb chop, vegetables soaked in butter, ranch dressing on a salad, ice cream for dessert. Here in the good old USA, starting as kids, we start pounding and destroying the endothelial production of nitric oxide. So that by their 40s and 50s, we now have this epidemic of cardiovascular disease, of heart attacks and strokes. Not a good plan. Not a good plan. All right. Now, today all we have time for is the endothelial cell. But I want you to know that these other natural defense mechanisms that we all have, all four of these are going to be absolutely optimized when you're eating whole food, plant-based nutrition. All right, well now let's really put this to the test. This was the first study that I did with patients who were severely ill with heart disease. They had failed their first or second bypass. They had failed their first or second angioplasty. They were too sick for this procedure or they had refused. And there were 5 who were told by expert cardiologists they wouldn't live out the year. Those 5 made it beyond 20 years. And the real concern that I had was, how was I going to convince these patients with heart disease to really make this transition to whole food plant-based nutrition, which is a very significant transition from the typical Western diet. So I decided that the mantra that I would use for these patients would be the same one that I had used really for my cancer patients, because at that time I was chairman of the breast cancer task force at the clinic. And so the mantra that I'm talking about I had learned years ago from a wonderful West Coast surgeon by the name of Bert Dunphy. And Bert used to say that patients with cancer are not afraid to suffer. Patients with cancer are not afraid to die. But patients with cancer are afraid of being abandoned by their family or by their physicians. So the first 5 years I saw every one of these patients every 2 weeks, drew blood, checked their cholesterol, weight, blood pressure, went over every morsel they ate. Then at the end of 5 years, I got a little bit more courageous, stretched it out, and I saw them, every one of them, every month, once a month. Most cardiologists, I think, will see their patients twice a year. At the end of a decade, they were now pretty well on autopilot, so I was able to stretch it out to see them quarterly. And then at the end of 12 years, we wrote them up in the peer-reviewed scientific literature, because this was now about as long as any study of its type. 12 years is practically half a career. So the main thing was this. Here are the foods that every time they pass your lips, you injure the endothelial cells, all right? Any drop of oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a piece of bread, oil in a salad dressing. Oil injures endothelial cells, as does anything with a mother or a face. Meat, fish, chicken, fowl, turkey, and eggs, and anything that is dairy, milk, cream, butter, cheese, ice cream and yogurt, and sugary drinks, diet colas, Pepsi and Coke, and sugary foods, cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey. For my heart patients who are that ill, I don't want them to have avocado or nuts or peanut butter or cashew sauce. And no coffee with caffeine. Hey, okay. What are you going to eat? We'll show you in a minute. For those of you who have concerns about what I just said about oil, here is a peer-reviewed scientific study. Olive, soybean, and palm oil intake have a similar acute detrimental effect over the endothelial function in healthy young subjects. Now, for those of you who get tied up in knots with the Atkins and paleo and keto, here's an argument or a discussion point that you might want to make with them, because they all are pushing meat. Well, here are the molecules that are found in these animal products that you see here that omnivores will eat. People who are eating animal products eat these molecules. And these molecules in omnivores are metabolized by the microbiome. That is, they have, if you're an omnivore, you have bacteria in your gut that will metabolize lecithin and carnitine into TMA, trimethylamine, which is rapidly oxidized in your liver to trimethylamine oxide. And trimethylamine oxide from these foods injures your blood vessels. Here's the schematic. Here's the lecithin and carnitine from the animal food you're eating. Your gut bacteria transition it to trimethylamine oxide, which will injure your blood vessels. But the exciting thing that Stan Hazen, who did this study, found out, if you take somebody who's fully plant-based, give them a lamb chop, measure their blood for TMAO, not there. Why? Because people who are plant-based do not possess in their microbiome the bacteria that can convert lecithin and carnitine to TMAO. Pretty exciting stuff. Yeah. All right. But if you keep eating that lamb chop for the next 4 days, then you're going to convert your microbiome to have those bacteria. You don't want that. All right. Here's what you're going to eat. All these marvelous whole grains for your cereal, bread, pasta, rolls, and bagels, 101 different types of legumes and lentils and beans, all these marvelous red, yellow, and green leafy vegetables, and sweet potatoes, white potatoes, and some fruit. Very exciting. Now, this is something that we've started in our program just in about the last 8 years. If I have somebody who's got significant heart disease, I ask them to just imagine shrinking your head to a size that could get inside that artery that has the blockage. You would see that that blockage is an absolute cauldron, a cauldron of oxidative inflammation. So we need antioxidants, but no. Do not go down to the health food store and buy a jug of pills that says antioxidant, because it doesn't work. It's going to be harmful. You're going to get your antioxidants from food. Fair enough. What food? Food that is high in what we call ORAC value, O-R-A-C, oxygen radical absorptive capacity. So, if you're having raspberries, blueberries, strawberries, and blackberries with your morning oat cereal, that's a terrific start. However, nothing is going to trump the antioxidant value of green leafy vegetables. So, I ask them to chew, not smoothies, not juicing. I want them to chew a green leafy vegetable 6 times a day after it has first been boiled in water, 5.5 to 6 minutes, or steamed till it's nice and tender. Then you must anoint it with several drops of a delightful balsamic vinegar. Why? Because the acetic acid in the balsamic has been shown to restore the nitric oxide synthase enzyme contained within the endothelial cell that is responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich. That's 3. Mid-afternoon, 4. Dinner time, 5. And God, I adore it when you have that evening snack of kale. What are you doing? All day long, you are basking and bathing that horrible oxidative cauldron of inflammation with nature's most powerful antioxidant. And the second thing that chewing the greens does, it restores the capacity of your bone marrow to make more endothelial progenitor cells. What are they? They replace our senescent, injured, worn out endothelial cells. All right. And the third thing that chewing the greens does, when you are chewing a green, you are chewing a nitrate. As you chew the nitrate, it is going to be mixing with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce the nitrate in your mouth to a nitrite. Now, when you swallow the nitrite, your own gastric acid is going to reduce that nitrate to more nitric oxide. So here we have this glorious way of eating. No extra expense, no hideous side effects. You're eating the greens, which are restoring nitric oxide, the very molecule that you were so deficient in that gave you heart disease in the first place. Okay. Now I'm going to show you at this point several angiograms. These are pictures of the coronary arteries of the heart that show disease reversal. These angiograms were all reviewed in triplicate in the Cleveland Clinic Angiography Core Laboratory. So if I tell you a certain percent, I know that it's accurate. Now, in this happens to be a retired 67-year-old pediatrician. You're looking at the left anterior descending coronary artery, and the amount of increase in size from the left to the right was described as 10%. A little easier to see. And this is really the circumflex artery to the back of the heart in a 58-year-old factory worker. And it was described as a 20% enlargement from here to here. On this next one, this happens to be a 54-year-old security guard, the right coronary artery. This was described as a 30% improvement. Now, this is Joe Crow. He's a surgical colleague of mine at the Cleveland Clinic. He replaced me as chairman of the breast cancer task force. In 1996, at age 44, Joe began to get chest pain, cholesterol 156. He was not a smoker. He was not diabetic. He did not have high blood pressure, no strong family history, exercised regularly, chest pain. In October of 96, cardiology worked him up. They could find nothing. And a month later, he sat down to write post-operative orders, having finished surgery. While he was writing the post-op orders, suddenly the elephant was sitting on his chest, pain in his left jaw, shoulder, arm. Joe was having a heart attack. He was whipped down to the cath lab. They started the catheterization. He had a cardiac arrest. They resuscitated him. And they finished the catheterization. One more cardiac arrest, resuscitated, sent up to the floors, and 3 days later he discharged, but very depressed. Why was he depressed? Because at the time of his angiogram, you can see here, the entire lower 1/3 of his left anterior descending widowmaker was all moth-eaten and diseased over too long a segment to be a candidate for you just can't pound in stent after stent after stent. It was too far down the artery for bypass. So he felt very depressed that they couldn't do much for him. So Ann and I had Joe and his wife out for supper 2 weeks after his heart attack. Joe, come on. You've been eating a horrible Western diet. You've got the typical Western disease. How about thinking about going plant-based? We've got 10 years of data. Okay, yes, I'm going to give it a shot. But I'm not going to take any of those statin drugs. I don't trust them, too many side effects. Fine, your call, no problem. He became the absolute personification of commitment to whole food plant-based nutrition over the next 2.5 years. Total cholesterol plummeted. LDL cholesterol went from 98 to 38. And then 2.5 years later, he had a repeat angiogram. So, since our office doors are not more than 3 doors apart, at noontime on the day I knew earlier that morning he had his follow-up angiogram, I walked over, opened the door to his office. There he was, sitting behind his desk. Joe, I heard you had your follow-up angiogram this morning. Mind sharing with me? How did it go? He got up from his desk, walked around, put his arms around me, a couple of these. He said, I think we may be doing okay. I said, well, would there be any chance that I could see the angiogram? He said, yes. Now, this is exciting, but it doesn't happen with everybody. When the plaque is young and made up of fat and cholesterol and inflammation, the body can do an outstanding job of getting rid of it. It's just like if you hit your index finger with a hammer. For the next several days, it's going to be pretty swollen, and then the swelling all goes away. Well, where are all those cells? Those inflammation cells. They're gone away, back to the liver, and taken care of. But the exciting thing is, what about those other 65 or 70% who have an old plaque that's made up of scar and fibrosis and calcification? It's not going to go away. Even those patients can get back to full activity of daily living without restriction, and it's going to be my responsibility before I finish today to show you how that happens. Okay. All right. Now, there were 6 of these original 24. Nice guys. But I knew within the first month they just didn't get it. And so I had no money for this study. So I released them back full-time for their expert cardiologists. They became sort of my quasi-control group. And over the next 12 years, those 6 who left the study, 2 died, and the other 4 had another bypass. Now, what about those 18 patients that stayed with us? I wanted to know, in the 8 years prior to coming into our study, how many, while in the hands of expert cardiologists, how many coronary events of worsening disease did they experience during this time period? 49. So then we wanted to see, once they came into our study, over the next 12 years, 17 of those 18 now had no further events. There was one little sheep who, after 6 years, wandered from the flock, got into the lamb chops, French fries, glazed donuts, more pain, had a bypass, but proves the point that I'm sharing with you today. All right. Now, I got pretty well hammered for this study because I don't know whether you know it or not, but I'm an enormous threat to medicine's biggest cash cow. Because if you have heart disease and you're not an emergency, and if you do this, you're not ever going to have a stent or a bypass. But regardless, the criticism went, Dr. Esselstyn, that's an awfully small study. It was not randomized or prospective. What makes you think, and your diet is very extreme, what makes you think that you can take a larger group and get similar results? So this time we did it again with 200 patients. 2 were lost to follow-up. How do we get them to adhere? Because that was, many physicians who have heard of our method try and they fail. Well, they're going to, and here's why. If you're going to have somebody change their lifestyle, you've got to show a patient respect. The only way that I know to show a patient respect is to give them my time. If you think that you're going to get somebody in your office in a 12 or 15-minute office visit to change their life without their spouse and change their lifestyle, it's not going to happen. What we do today is once a month, usually for 12 or 16 patients, at the Cleveland Clinic Wellness Institute, I conduct a single-day, 6-hour seminar. Those patients are going to learn all about how they have created their disease and precisely how we are going to empower them as the locus of control to halt and reverse their disease. Now just think of this for a minute. Adherence. Let's suppose you're a patient with heart disease. But now, in our study, or in our seminar, you know darn well what the endothelium is and what nitric oxide is. And you also know darn well that the only reason that you had this disease is because what you had been eating. Now, we are asking you to eat the same foods you've been eating all your life, but we are asking you to get rid of the foods that every time they pass your lips, you injure your endothelial cell. How many people who have a brain in their head, who've already had a heart attack, are going to look me in the eye and say, Dr. Esselstyn, that was really very interesting, but Lois and I are going to have our 35th wedding anniversary in 2 weeks, and boy, am I going to trash some more endothelial cells. What? Doesn't happen if you show patient respect. Now, here's the other thing that was interesting. Somebody say, how do you know Dr. Esselstyn's patients were sick? Well, 119 of those 177 had already had a bypass or a stent. 44 had already had a heart attack. But here's the exciting one. 27 patients were told before they came to see us they'd have to have a stent or a bypass. After they saw us, no need. No need for stent or bypass. Okay. And the results of those who were adherent. We did have one patient who, when he was visiting China, absolutely ate off the economy, all that salt, had a small stroke. The 21 patients who did not follow the program, 62% had disease progression. Now what you're seeing here is I wanted to compare our results with some of those very so-called excellent results that standard cardiology is getting. And what you see here is heart attack, how many heart attacks, stroke, and death. Over here on the far right, this is the Lyon diet heart study, the Mediterranean diet heart study. At the end of 4 years, 25% had had a heart attack, stroke, and death. Here we have Columbia Presbyterian Hospital in New York City, the natural history of heart disease, 20% at 4 years, heart attack, stroke, and death. Bill Bowden's Carotid study, 19. So here you are, somewhere around 21, 22%. That's over a 30-fold difference from where we are right here, 0.6%. Why is it that our results are so much better? We are treating the causation of the illness. That's what's different. We are treating the causation of the illness. And there's been an absolute basic covenant of trust between the caregiver and the patient since the days of Hippocrates, that whenever possible, the caregiver will share with the patient what is the causation of the illness. And sadly today in cardiovascular medicine, that just isn't being done. As a matter of fact, 4 years ago, I was invited by the American College of Cardiology to become a member of because they wanted me to join their nutrition committee, which I did. And the biggest job we have is trying to educate cardiologists about the causation of the illness that they have been designated to treat. Pretty exciting. In July of 2014, this is another paper, only 3 patients. What right did I have writing a scientific paper on 3 patients? Because these 3 patients totally represented the absolute disaster of present cardiology approach. The first gentleman is from Newfoundland, Canada, Bob Mercer, age 44, totally blocked right carotid artery, small stroke. But he was having severe angina. Found a surgeon in Toronto who operated on him. Even though he had one totally blocked carotid artery, he had a splendid result from his angina. Now he was 69 and he was in trouble again. He was 40 pounds overweight. He was diabetic. He had all this angina back again. He had erectile dysfunction. And his one remaining carotid was now 90% blocked. Of all things to happen at this moment, his daughter, 37, has a heart attack. In her convalescence, she found a book, Prevent and Reverse Heart Disease. And she said, Pop, we got to do this together. They did. And a year later, I got a letter from Bob Mercer, Dr. Esselstyn. I know we haven't met, but I wanted to thank you. I followed your book, and he said, I've lost 40 pounds. My diabetes is gone. My angina, gone. My erectile dysfunction, gone. And my one remaining carotid artery, which was 90% blocked, is now 67% blocked. Here's Bob Mercer. Now, the other one I wanted to show you was Art Soteros. Art is from a suburb of Cleveland. At age 32, he was overweight, became diabetic. At age 42, he had, at the Cleveland Clinic, the first of 14 stents. And they said, these aren't working. You better have a bypass. He did. And it was great for 12 months. Then he had his pain again. And they said, you'll just have to get by on these drugs. He didn't like that idea. So he somehow found us. And he was absolutely the personification of commitment, lost 40 pounds, got rid of all of his diabetes, got rid of all of his chest pain. He did great. And for 5 years, I had him tell his story at our seminar. And then, sadly, he fell in love. And his fiancée, he was very bashful about showing his reticence to eat at restaurants. So they started eating at restaurants. When you eat at a restaurant, you're going to get oil. So last September, a year ago, said, Dr. Esselstyn, I seem to be getting some discomfort. We had him, long story short, 7 more stents. So someday I'm sure I'll get him back because he's really taught his beloved how important it is, how he should eat. And here he is, before and after. Now, so you have to stick with it. This is Jim McNamara on the left. At age 55, he had a stroke, and they operated on this right carotid, and it failed, totally blocked. Then he began getting this pain in his leg. He could walk about from here across the hall, and he would get this pain. And they ended up operating on his leg. First one failed, second one failed, third one failed, just like the operating on his carotid artery failed. Everything was failing. He was told he had this aggressive disease. His wife found us. He came on board, lost 40 pounds, got rid of his pre-diabetic state. He now can walk nonstop. Here he is, 6 months after he came in the program, dancing with his daughter at her wedding. So, summarizing. No mortality with the diet, no morbidity with the diet. The benefits improve with time. And think about it. Somebody who's had a heart attack is walking around with the sword of Damocles hanging over their head. When do I get my next heart attack? Nonsense. You never have to have a second heart attack. You've got to learn to live in a way that you make yourself heart attack proof. Now, what's the good of having a great heart if your brain doesn't get it? All right? So we know that by the time you're 85 years of age, in this country or in Sweden, 50% of people have dementia. All right? We learned from Megan Leary and her team who presented their data at the stroke meetings in 2001. They had looked at over 5,500 MRIs of the brains of Americans. And what do they find at age 50? These tiny little white spots in the brains of Americans. What are they? Little strokes, you know. But age 50, big brain, tiny stroke. Well, you blink your eyes, you're 75. You've had now 15 more years of the good old American diet. More often than before, you say, sweetheart, where did I leave the car keys? Well, not a problem. But you blink your eyes again, you're 75. 10 more years of the good old American diet. You look at her and you say, sweetheart, where did I leave the car? 10 more years, now you're 85. You look at her and you say, are you my sweetheart? I can't reverse that. You don't suddenly wake up on your 85th birthday with dementia. You work hard in all those preceding decades, to lay the foundation of that dementia. All right. Now here is a normal MRI. Here is one. I counted 90 of those little strokes. Can you imagine a message trying to get through all that scar? All right. Now here, look at this. The brain is all the way out to the skull. It fills the whole skull. Here, what is this gap here? You don't want that. That's cerebral atrophy. Your brain is getting smaller. How do you protect yourself from getting a small brain? Exercise. If you're going to walk 4 or 5, 6 times a week, almost fast enough to break a sweat, or you bike, or you swim, but exercise keeps your hippocampus memory growing, frontal lobe executive thinking growing. All right, now here on the left, you have the thigh muscle of a 40-year-old triathlete. On the upper right, you have the thigh muscle of a 74-year-old couch potato. Lower right, a 70-year-old triathlete. Exercise. Now, on the left here, you see the pulse volume of the ankle of a gentleman. When he first started seeing me, he had to stop 5 times crossing the skyway to my office because of pain in his right calf because he had a partially blocked artery in his thigh. But I was so focused on his heart, I forgot all about his leg. 11 months after seeing us one day in the office, he said, "Dr. Esselstyn, do you recall when I first started seeing you, I had to stop 5 times crossing the skyway to your office?" "Yeah." He said, "You know, the last month, it got to be 4 times, 3 times, 2 times, once." He said, "I don't stop. The pain is gone." "Okay, Don." Back you go to the vascular lab, and bingo. What do we see? My gosh, it's now double. We suddenly had now, in this early study, absolutely rock solid scientific data that food and food alone could reverse cardiovascular disease. And you're going to say, well, now, wait a minute. What about the statin drug? Well, 1986, we didn't have any statin drugs, okay? Yeah, pretty exciting. Here's another. What you're seeing here, this is a 78-year-old retired high school chemistry teacher. And in his retirement, he and his wife love to enter square dances. But during the fast square dance, he was getting bilateral calf pain. So he saw these vascular surgeons, and they got the picture that you see up here. And he didn't like the idea of the big operation they were suggesting. So he said, "Dr. Esselstyn, if I choose your method, how long will it take for me to get rid of this calf pain?" So I looked at him with great wisdom in my face. Probably 10 or 11 months. 3 months later, I got a phone call. "Dr. Esselstyn, you do not speak the truth. The pain is gone." Now, I don't know what it's like in this part of Illinois, but in Cleveland, Ohio, when you're watching a mystery or a sporting event, just before the advertisement comes on, you will hear the mellifluous tones of the announcer say something like, "When the moment is right, will you be ready?" Now, we all know that the penile artery is really quite tiny compared to the size of the coronary artery to the heart, so not infrequently before somebody comes down with heart disease, they may find that they're having difficulty raising the flag. However, all is not lost, not infrequently. 10 or 11 months after I've seen somebody, I'll get a phone call. "Dr. Esselstyn, yep, this is Mr. So-and-so." Sure enough. "Yeah, I really thought I ought to give you a call because recently something has come up. And I'm wondering if I don't owe you another check." All right. Now, this is wrapping it up. I promised before it ended, how do patients who have a plaque that is not going to go away in their epicardial coronary artery, how is it that it gets better? All right, here you're looking at a PET scan. And in the PET scan, if it is orange or yellow, that's good. You got good blood supply. But here it's very, very bad, green. This happens to be in a 60-year-old stockbroker, 248 cholesterol, and I counseled him when we had this done. 10 days later, his cholesterol was 137. Then 3 weeks later, we repeated it. It's all back. We didn't wash out any plaque in 3 weeks. How does that happen? This is the heart, no muscle. You can see the three large arteries, the right coronary artery, the left anterior descending, and the circumflex. But where do they go? They all dive into the muscle. So I called Rodriguez, who's a Cleveland Clinic cardiovascular pathologist, and said, who dissects over 200 hearts a year from the deceased. I said, Rod, how often do you ever see coronary artery blockages once the artery has dived into the heart muscle? His answer? Never. Once in a very great while with a severe diabetic. Otherwise, never. Now we had our answer. How are these patients getting better? When you see these patients initially, they are so beaten down, their endothelial cells are barely making any nitric oxide, the great vessel dilator, and they're now your enemy. Your endothelial cells are making two molecules, thromboxane and endothelin, which are vessel constrictors. So this whole vast cascade of thousands of interconnecting vessels are all pinched. They don't have a mechanical block, but they're pinched from the spasm from those molecules. So what happens as soon as the patients stop any further injury to the endothelium, it recovers. Now they start making nitric oxide, the great vessel dilator, and at the same time they stop making endothelin and thromboxane, the vessel constrictors. And so what happens, this entire cascade of thousands and thousands of interconnecting vessels opens up. And if you recall, in physics, Poiseuille's law of flow through the hollow viscous is rated to the fourth power of the radius. Translation, tiny increase in diameter, huge increase in flow. All right. And here's a summary of the 8 ways that you can reverse disease. We talked about the angiogram, stress test, showed you the PET scan, talked about carotids, legs, and the symptoms of angina, claudication, and erectile dysfunction. All 8 of these are disease reversal. Now, since many of you haven't been to Cleveland, I wanted you to see this is the building where I worked on the 8th floor as a surgeon for many years. But I show it to you from Illinois to show you what the trees look like in Cleveland in February. However, now that I've retired from surgery, I now work at the Cleveland Clinic Wellness Institute, where the budget is more modest, but the morale is quite high. And one thing I've learned in 58 years since leaving medical school is, while brains are important, nothing is as important perhaps as persistence, 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 best exemplified by this young damsel in Life magazine, 1939, trying to learn how to do the splits. But she stuck with it, and sure enough, the other day in downtown Tinley Park, Julie, our great organizer here, spotted her, and she got it right. So, in summary, why is it that I'm so passionate about medicine, even 20 years out from retiring as a surgeon? Because we are truly at the cusp of what could be an absolute seismic revolution in health in this country. And this seismic revolution in health will never come about. It's never going to come about with a pill or a procedure or an operation. But the seismic revolution in health will come about when we in the profession have the will and the grit and the determination to share with the public what is the lifestyle, and most specifically, what is the nutritional literacy that will empower them to absolutely annihilate chronic illness. Thank you.